So now take air out. Good, take more air out. होता क्या है कि mucosa actually comes in between, right? No, go anti-clock now. More anti-clock. Okay, pull back now. Pull back a little bit. Pull back. Pull your scope back. थोड़ा सा. Okay, now tip up. Tip up and clockwise anti-clock rotation. Right. Clockwise anti-clock rotation. Okay. When you will rotate, you will see something here. So we saw one vascular structure come and go, right? So if we do this, कहाँ गया आपका? Just straight. थोड़ा सा rotate कर. हाँ. Okay. You've got aorta there. Go more and pressed. Right? ये देख रहे हैं? This is IVC.
Okay, IVC. Yes.
IVC is compressible. Go more anti-clock. You've got right kidney. Now you're just moving you're not doing anything. You're just moving your hands. Your shoulder, ठीक है? इसको घुमाते रहे. You've got aorta, right? Keep going. You've got one of the ducts right there. So you see the ducts. Are we with you guys? So ducts in D2 start coming in this area, okay? So this is one of the ducts that's coming, that should be the CBD. Okay, so now just gently let go of your big wheel. थोड़ा सा इसको tip forward करें और clockwise rotation रखें. You don't change your clockwise. अगर आप tip down कर रहे हैं तो बाकी चीज़ें थोड़ी change कर रहे हैं. Now pull back now and pull back slowly. Slowly pull back. Slowly and keep doing clockwise anti-clock gentle movement. Okay, pull back, pull back, pull back थोड़ा सा. Okay, that's your uncinate, okay?
Which one?
This whole thing is uncinate,
okay? Right.
Okay? And now you have the superior mesenteric vessels will be here,
right?
And you should see the CBD and PD coming here. Obviously, they're easy when they are very dilated, and they're not so easy when they're not so dilated. But there it is, right there is the CBD. There, that's the CBD, and that should be the PD. So you need to let go of your big wheel a little bit. फ्रंट पे करें, टिप डाउन, वापस एंटी क्लॉक, काउंटर क्लॉकवाइज मूवमेंट करें, क्लॉकवाइज मूवमेंट, काउंटर क्लॉकवाइज मूवमेंट करें. हाँ, करें. Think you probably fallen back into the stomach. Okay, so that's how you do it. So we'll just go ahead and show the mass that we have seen in the tail, and that's your gallbladder. Somebody was asking me, how do you see the gallbladder? That's we are just right near the pylorus. And we can see the whole gallbladder just next to the liver there. Okay, so we'll come to the area of interest here, which is just here. Okay, that's the mass. So this is a mass in the body of the pancreas which has cystic component to it, but obviously there is can you all appreciate it? I don't know if you guys are with me or not.
Yes, we can see.
Okay, so we want to make sure there is no major vessel there. So this is probably a cystic lesion that may have turned into something more sinister. The threshold that we have, I like it here. So everything is good. What I was telling you is that I took this off. If you want to, you can lock things. Floor dalo. Okay, so we are good. Needles coming out, we are fine, right? And there is no tightness that I feel. I've got it at almost 90 angle. Take the flow off, please. Nope, I went into it but slightly sideways, so I'm just going to bring it more here and we are in. Okay, so once we are in, I take the trocar out. It is hard, so I come back. This is FNB22G, right?
Yes.
So I go 1 and I'm not going to go here. I go 2 and I can change my position with my big wheel. I'm letting go of it. So when I go tip up, this is the position. When I go tip down, this is the position. So I've got a different place, different plane. Come back again. And if I want to go to a different place completely, then I can pull back this lesion a little bit and see if I get here. Okay? I think that's enough. That, by the way, was not the splenic vessel because we checked it, okay? These are cystic spaces. So this is a, if I was to measure, we did before, but this is a better, more circumscribed lesion that's about, यार इसका कुछ गड़बड़ है यार, what is happening here? अब ये सही नहीं दे रहा वसीम, there is something wrong.
डॉक्टर साहब ये एंडोस्कोपिक व्यू खत्म करें, इसके पीछे रीडिंग है.
नहीं I know, but it's not.
बंद करें इसको, एंडोस्कोपी बंद करें, पूरा लिखा हुआ है.
निकालो, हटाओ यार इसको.
वो देखें, वो उसने एंडोस्कोपी लगा दी. दूसरा लगाएं आप.
लगाओ करो इसको.
नहीं ये देखिए, इसको बंद
that's
करें.
it, 31, 18. So this is 3 by 2 centimeters. That's what we had approximately. So it's a little larger in the other picture. But so the way we describe this is that this is a cystic. This could be a cystic lesion that's turned into a mucinous cyst adenocarcinoma, because there is some cystic element to it. But that's, you know, what difference does it make? All we know is that this is a hypoechoic lesion with some cystic spaces. Can this be something other than pancreatic? It is in the pancreatic head. It could be, most likely, in my opinion, this is a cystic lesion that has converted into something. I can't see any vascular involvement, although CT scan said that the celiac was blocked. It's away from the kidney, you can see that, and it's away from the spleen as well. We've looked at the celiac thing, and I'll have a look at it once I get clearance in terms of biopsies का आ जाए तो फिर मैं, becomes a little bigger if you look at it here. This is where I measured it before, so it was a bigger. Are you a biopsy? Have we got sample? Good? Done? Done? Thank you. So we've got sample enough, adequate. So what we are going to look at now is to see if we can see the celiac, take off and then see if that celiac is actually involved by this mass. You see the adrenal very nicely there. That's the celiac coming here. Really speaking, I can't see that the celiac is involved. But then the CT is obviously, because to me the tumor is, or the lesion is a little further down, so in my field I can't see it, but that doesn't mean that CT is not right.
Okay, sir, because this is partly cystic lesion, would you give antibiotics after?
Yes, we give antibiotics. I was just listening to Khalid. We give antibiotics to everybody. Any FNA, FNB we give antibiotics to all patients. Although I've only gone into the to the hard solid component, but still we feel that, okay, so we are done almost here. There were a few lymph nodes, but they were not significant. So come back and show me mediastinum now. एक दफ़ा जो है ना, just practice the liver thing again. Lift your tip up, and I want your scope straight. So that means you need to stand back, stand back. I'm standing here. Now rotate. Yeah, just take this there, gently. Yeah. We are done. हाँ ना, बस खत्म, हटाओ. करते जाओ, करते जाओ, करते जाओ, करते जाओ. There you are. You cannot miss. I mean, with a little bit of practice, and what I do is I go in women 35 usually geojunction. I go at 40, and that's where I tip up. You see liver rotate clockwise, clockwise rotation, and you will almost always see aorta, and then you follow the aorta. Is that good?
Yes.
Understood? So you come back and show me subcarina quickly, please. So subcarina, what I do is 35,
35.
in women 30. Okay. So now a little bit of and tip up. Okay. Tip up करें थोड़ी और. See. So you were actually got subcarina straight. You pull back a little bit. You have ये तो रट गया होगा, I'm sure. But aorta, left atrium, subcarina. To see subcarina, what you need to do is you need to just move this a little bit here so that space opens up for you. Clockwise, little bit anti-clock, again clock, tip a little bit away, tip close to you, and you've done. Okay? For AP window, like we said, this hand goes down all the way. Pull back your scope. You'll start seeing the aortic. You start seeing aorta there. Okay, good. In fact, you've actually got it right there. Yeah. Okay? That's your AP window with the pulmonary aorta there. Yeah. Okay. In fact, I'm not sure. 1 minute. Just come back a little bit, and now rotate. थोड़ा सा आगे जाके. Just you need to just go a little bit. I'm sorry, I'm missing it out. But what you need to do is just come to the aortic knuckle, bring it here onto the under the transducer, and then just go in a little bit and a clockwise turn and a little bit of clockwise movement, and you get it. Okay, so we're done. आप निकल रहे हैं सर?
ओके जी, थैंक यू वेरी मच.
आपने मेरा एक काम सिर्फ करना है.